So I'm Kevin Moss, I'm the Product Development Director at Rescape. So it's such an exciting time in VR at the moment. I feel very lucky to be involved in the middle of that. So I think my job essentially is to take VR and the medical research that we're seeing and combining those two bits and create products that people really want to use. And my background is in user-centric design, so I think that's a really exciting way to kind of view medical product development. And so we're very keen that the products we make work not only for the patients and make sure that we're delivering something for the patients, but also make sure that we understand where they sit in the ecosystem of either a hospice or a hospital, and make sure clinicians can actually use those products and they're beneficial for people. So what's interesting about Dr. VR is its simplicity. And sometimes as product development directors, we don't want to talk about simplicity, we want to make things complicated. But actually what's interesting about the Dr. VR, it takes the fundamental idea of distraction therapy and the fact that we can fool patients' brain into thinking something. So if they're in acute pain, we can help their brain take away some of that pain by putting them in another place. But also we've created a product that allows us to let the clinicians be involved in that process. And also, so by us creating a tablet and the VR experience that kind of work together, we can allow the clinician to kind of lead that patient through that and actually relieve some of the anxiety of technology. And I think it's fair to say VR is a new piece of technology, and it would be silly for us to think that anyone is going to just put on a headset and feel comfortable within that. So part of our job and part of what's exciting about Dr. VR is that we've solved some of those problems and we've taken the stress of technology away and like kind of just made it a very simple process where you can sit and encounter different experiences. So those experiences range from skydiving and like going off and looking around cities and going to amazing cities all around the world, or actually just experiencing something in Africa and looking at elephants. And I think it's a mix of not only the visual, and what we've seen is the audio is really important. It's like a vital important part of the fact that when you're immersed in this moment, following the audio signals that you're given immerses you more. And to some degree, the real point of Dr. VR is to immerse you. And that's what VR does, is it takes you out the world you're in and puts you somewhere else. And so audio can do that. Simple things like we have follow the flock of birds. Did you notice the flock of birds that just flew by? That puts you in that moment. You can look around this world that VR creates and follow that flock of bird, and that immerses you more in the moment. And ultimately what we're always trying to do is take away someone's pain, take away their anxiety in that moment that they're feeling it.